What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani, and today I have the honor and pleasure of speaking to a person, a human being that I have been waiting to connect with. Our last call had to be rescheduled. She was gracious enough to reschedule and come back on today. So without further ado, Dr. Audrey Wells, welcome to the podcast. I am stoked to have you here.
I'm stoked to be here, and it's a pleasure to talk about one of my favorite things, which is sleep. So I'm really
Yes.
honored to have your invitation. Thank you.
Thank you. So you are I'm going to look at you, but for those that are listening and you know that I will post her bio in our show notes, but she is board certified in sleep medicine as well as obesity medicine. And she has a super amazing community, which I will share. We'll go into that as we get into the show. But that brought up some of the newest news that we have in the world of sleep and obesity, which is the use of GLP-1 medications and its role in treatment. Did I say that? Treatment of sleep apnea? Would you dive into that?
Yeah, definitely. I think this is really exciting news, and I've kind of been waiting with bated breath for it to come out because, these highly effective GLP-1 medications are really up-leveling the treatment options for obesity care. And most recently, there was a new study coming out describing the effectiveness of tirzepatide or Zepbound on obstructive sleep apnea. And I think a lot of people are going to want to understand this news and even how it applies to them individually. So I'm really happy to have this dialogue with you.
Yeah, let's dive in. How does it work? What is the mode of action? What can patients expect? I have so many questions. When would you recommend this? And if you would just go down this rabbit hole with me.
Yeah, all the things, right? I mean, obesity is such a, sort of a passion of mine because it has such a strong overlap with obstructive sleep apnea. In fact, it is one of the biggest risk factors for obstructive sleep apnea. But there's some misconceptions or myths out there, one of which is that if you are someone who struggles with obesity, then you have sleep apnea 100% of the time. Another myth is if you lose weight or get down to a normal BMI, body mass index, your sleep apnea, if present, will resolve. So I want to kind of break that up. And I think that talking about tirzepatide or Zepbound is a great start. So initially, these highly effective GLP-1 medications were used among diabetes folks, people who were trying to treat their diabetes. And what was noticed was that these people were losing weight. And so more research was done to identify both semaglutide or Ozempic / Wegovy and tirzepatide, which is Zepbound, as weight loss medications primarily. Now, GLP-1 is sort of the main driver, but Zepbound is a little different because not only does it contain GLP-1, it also contains GIP, which is another metabolism hormone. And this injection happens once a week. And in the research studies, the test participants were showing weight loss around 20% of their total body weight, even some people 25% and above. So very significant and even overlapping with bariatric surgery procedures like the gastric sleeve or the Roux-en-Y. So this was exciting news. And I want to point out that in the clinical trials, the patient population that got placebo, in other words, they were doing the injections, they didn't know if they had the active medication, but they were going through that motion of injecting, and they received the same lifestyle interventions, which were diet support, exercise support, and support for positive behavioral change. The placebo group lost 11% of their total body weight. So that is quite significant as well. And it sort of underscores the importance of healthy lifestyle habits as a significant part of a weight loss journey. Well, the next step, I think, is very clear among people who practice sleep medicine, which is what could this do for people who also suffer from obstructive sleep apnea. So I've been answering a lot of questions about this lately. And the truth is, the effects that Zepbound can have on obstructive sleep apnea are related to weight loss. And what was demonstrated in the clinical studies, the SURMOUNT OSA trials, are that the reduction in AHI looks to be very significant. So you're reducing the severity of obstructive sleep apnea, which is great news because when that severity comes down, and especially if you land in a place where your sleep apnea is mild, maybe moderate, you can open up new treatment options. Now, most people are really interested in knowing, but how often does it present a cure? And we have some information from the bariatric surgery world, such that when people were getting down to a normal body mass index after surgery, or maybe a near normal body mass index, what was seen was that they were able to discontinue CPAP because their sleep apnea had resolved about 40 to 50% of the time. Why wasn't it 100%? Well, it's because there's more than just a big tongue. There's more than just airway fatty deposits and having a big belly that contribute to obstructive sleep apnea. So the good news is we can treat obesity much better than before. It can certainly have the potential to make sleep apnea less severe. And for some people, maybe about half who get down to a normal body mass index, either they are able to discontinue use of their CPAP treatment or look into alternative therapies.
Yeah, it certainly opens up a whole new world of possibilities. And I love that you mentioned the lifestyle changes, the lifestyle modifications still have to be there. It's not the magic wand, that's not the magic pill. So let's kind of segue into what should that look like by way of sleep for these patients? And I know we talk about sleep hygiene, but what truly constitutes healthy sleep?
You know, there is a metric out there, which is number of hours of sleep that people are typically shooting for. And that's just the sleep quantity. But when I talk about healthy sleep, there's really three factors. So sleep quantity is one of them. And adults should be getting at least 7 hours of sleep. Sometimes the report is 7 to 9 hours, but I think if you're up there at 9 hours, you could be compensating for a sleep disorder that hasn't been diagnosed yet. So I like to see 7 to 8 hours as the metric for quantity. Then there's quality sleep. And you can support your sleep quality with good daytime habits, meaning you get exercise, you get light exposure, preferentially from, being outside in the sunshine. You have healthy social interactions. You're doing something during the day that gives you joy or creativity or is an outlet for, intellectual flow. And your meals are healthy with unprocessed foods and maybe minimally processed foods making up the majority of your diet. And you're stopping eating 3 hours before bedtime. So all of these things help to improve or increase sleep quality. Then there's timing. Timing refers to when is your sleep period? Is it consistent and regular day after day, even including weekends? And does it match your internal genetic chronotype? So are you an early bird? Are you a night owl? And does your sleep period sort of optimize that sleep timing? So quantity, quality, and timing are the three metrics of healthy sleep.
Can we go a little bit into the chronotypes, the night bird, night owl, morning, early bird chronotypes and such, because that is always a source of frustration with the patients that I see. I guess they're so sleep deprived. They're like, I don't even know. I just sleep when I can. How can people even understand or begin to figure out where they fit into it? And then let's not even go into teenagers, right? Like they're all over the place. Can we dive a little bit into that? And how can our listeners that are supporting, but also other professionals who are obviously not the experts like you are, how can we help support our patients in this?
Yeah, I think your point is well taken, that if there is a sleep disorder that's not fully treated, it's very difficult to identify what the optimal sleep timing would be, or even have trust in your sleep, right? Trust that you're going to fall asleep when you want to and be alert when you want to. And that's very disconcerting for people. So assuming that there's either no sleep disorder or the sleep disorder is fully treated, then I like to ask people to think about when they're on vacation, maybe for a week or two, or, just a time in their lives when they were able to hold their sleep schedule in a consistent pattern. How did they feel with that? Did they feel like they wanted to maybe wake up later than their job obligation demanded, or did they do okay with that? The brain loves consistency because it can be efficient in that way. And so if people are looking to make a step toward working this out for themselves, what I recommend, first of all, is holding the wake up time consistent and let the bedtime expectation go a little bit, because you have less control over that. But you can wake up at the same time every day and establish that regularity from which then to decide, am I really a morning person? Am I more of a night owl? Or like 65% of the population, am I somewhere in between?
And can this change throughout your life? Can we
Well, you
go from
mentioned
one to the other?
Yeah, you mentioned teenagers, which is a really fascinating time period because there's so many physiologic changes going on. And it's developmentally appropriate for teenagers to shift their sleep schedule to want to go to bed later and wake up later. And fortunately, there are champions of late school start times, which are going to help kids to
Yes.
not only sleep more, but also to learn better in those first morning classes. First and second period are going to be really tough for teenagers going through this change. So that is isolated to this developmental time in life. But in general, after the brain is finished developing at about age 25, the sleep chronotype is fairly locked in until you start getting into the senior territory. And as people get into their later 60s, 70s, and beyond, there is a slight tendency for people to shift to an earlier chronotype, but it's not hugely dramatic. It's just something that's maybe noticeable for some.
So then that brings us to the question of sleep apnea. We talk a lot about the symptoms as, people being overly tired, snoring, of course. A lot of people don't seem to understand how important it is that it be addressed. What are the most common health consequences that you, as a specialist, like to warn patients about, or that you see patients come up with?
I like to highlight 4 things that sleep apnea can make worse. And I want to relate this a little bit to the causes of death in the United States. And I think that's how people kind of come to pay attention to their sleep when they understand that the way you're sleeping now informs the last 10 years of your life and whether you're going to have a good quality of life or you're going to live that decade in disease. So, for example, obstructive sleep apnea with the drops in blood oxygen level and the sleep disruption makes cardiovascular disease worse. And if you don't already have it, it increases your risk for things like heart attack and stroke and high blood pressure. So when you look at that as the number one killer of folks in America, then you can start to see not just how sleep can inform your state of disease, but also you've got a lot of control over how you're going to spend that last decade. Another way that sleep influences health is through metabolic processes. So people who don't sleep well because they have some degree of untreated sleep apnea are more at risk for diabetes and more at risk for weight gain. And I have a whole talk called Sleep Loss Cancels Out Weight Loss. So, kind of thinking about the discussion we were having before, you can actually sabotage your efforts at weight loss by not paying attention and prioritizing your sleep. Sleep deprivation is also linked to dementia, in particular Alzheimer's dementia. And so it's not just that people want to live longer, they want to preserve their quality of life. I don't think it's the heart attack that kills you that really gets your attention. It's like the dementia or the heart attack that takes away your independence and makes you dependent on your family members that you want to avoid. So that's 3: heart disease, diabetes, and weight gain. And then thirdly,
The
the
dementia and such.
dementia. Thank you. And then fourth, mental health. Okay. If you're not getting enough sleep, your mental health will suffer. More anxiety, more depression, more emotional lability. And a little bit, it's like the boiled frog effect. When you're not sleeping well, it kind of comes on slowly and you explain it away. But the truth is, if you can right your vehicle back into normal, healthy sleep, you can actually start feeling better mentally. And I think that speaks a lot to sleep's power over your day-to-day functioning.
Yeah, yeah, for sure. I always tell patients like prevention is so much more better than cure. Like you said, right that vehicle before we get into a wreck and then have to address that. Treatment options. I know the CPAP is what we are all taught as being the gold standard. What are your tools that you employ with your patients? Because it seems like we're coming back full circle in our conversation too. We started with the Zepbound and all of that, and we're coming back to how we can help our patients. What tools do you commonly employ to help your patients with the sleep issues and sleep
Yeah,
disorders?
CPAP is historically the gold standard choice for treatment of obstructive sleep apnea. And part of it's because, anybody who has obstructive sleep apnea, I can correct them with CPAP. But the problem is using it. It is not effective. If it's in your closet or if the mask is off of your face for the second half of the night. So in clinical practice, I am very frustrated with the support that the medical delivery system was not providing folks who were trying to use CPAP. And to kind of answer that problem, I created a solution for people that would give them high level support, that would give them credible information so that they could really decide whether CPAP fit into their lives or not. And I think until you're supported with good information and like that encouragement that you need to get over using CPAP, you're really not in a place to make an informed decision. I'm a big advocate for people making a choice that's going to fit into their life. So I actually created a course called 21 Plus CPAP Alternatives that allows people to know what else is out there. That's a question I get all the time. And I talk about non-surgical treatments and I talk about the surgical treatment. So CPAP, yes, it is the gold standard. I like to help people who are struggling to use it get over that. But if they kind of get themselves informed and have access to support and then decide it's still not a part of what I want to do to correct my sleep apnea, let's look at other options. There's a big menu out there.
Yes, that's great. And I was going to ask you that, like, what else? How can patients? Since you mentioned your course, let's get into that. How can our listeners find you? How can they contact you? How can they potentially work with you? Would you share all of those details with us?
Definitely. So my website and my company are Super Sleep MD. So if you go to www.supersleepmd.com, you can have access to the 3 courses that are online, available, and can be repeated because we're working with sleepy people here, right? So you
Right.
you can watch these courses, and they're really just a series of short videos that address all of the things that I gathered in clinical practice as meaningful and helpful. And now I'm telling you all the things I wanted to say in our 20-minute visit, but couldn't. So I
Mhm.
think it's just chock full of information that people can use, actionable steps, and really helpful guidelines. In particular, the 21 Plus CPAP Alternatives course addresses what sort of criteria are a patient would need to have in order to pursue one treatment versus another. I talk about insurance coverage so you can save time, you can save money. And I have a little fun part called the family test, which is, would I recommend this treatment to a family member of mine who has obstructive sleep apnea? So this is my opinion, and I certainly have a disclaimer running throughout that I'm a doctor, I'm not your doctor, but I'm going to tell you about my expertise. So people can access that online. They buy the videos. There's lifetime access. And I think an important thing is the ability to watch it when you want and watch it as many times as you want.
I love it. So not just for our listeners that are listening, and this is a great resource for you, but for my dentists that are tuned into this episode. I know this is a resource I will be sharing with my patients. Hey, go to her website, and it has information from a MD's perspective as to what your best option is. So I think it's a great resource for everybody, doctors, patients alike. So thank you for creating that.
It
As
was
we wrap
really
up
my
today,
pleasure.
oh, thank you. As we wrap up today's episode, I usually ask our guests, my guests, what are your top 3 tips for our listeners when it comes to their sleep?
I want to say, first of all, that if listening to this made you sort of take a second look at your sleep quantity, your sleep quality, and your sleep timing, now the next step is prioritizing your sleep. And I hope that I gave your listeners sort of a window into the power that healthy sleep has in our life. Another thing I want to say, and this is more related to the treatment of obstructive sleep apnea, is that to me, this 4-hour mark for compliance, I don't like that word, I call it adherence instead. The 4-hour adherence to sleep apnea treatment is such a low bar for health. What you're missing out in the second half of the night is treating your REM sleep, improving your sleep continuity, and really maximizing the benefit of that sleep apnea treatment, not only for the next day, but for every day on and on. So in my mind, adequate sleep apnea treatment occurs nightly and throughout the entire sleep period so that you're soaking up all the benefits of healthy sleep.
I could not have said it better. I keep trying to beat it over people's heads. Obviously, this was amazing. I'm going to make a little clip of this and have all my patients listen to it. Thank you so much for being a part of the healthy sleep revolution. It has been amazing having you on for today's episode. We will have to plan something to bring you back on again next time. To our listeners, her website is supersleepmd.com. Please go take advantage of all the resources Dr. Wells has created and is sharing with the world. I know you know somebody that needs to listen to this episode. So make sure you share, leave us a review, and I will see you guys next time.